This lecture will be on gait, outlining the normal physiological gait cycle, and then focusing on antalgic, short leg, and Trendelenburg gait patterns. We regard one leg at a time when looking at the gait cycle. Gait is divided into the stance phase, when the foot is in contact with the floor, and the swing phase, when the foot is in the air. Each of these two phases may be subdivided into smaller sections. The stance phase normally takes up about 60% of the time of the entire gait cycle. This means that the foot is on the floor for longer than it is in the air, and there is therefore a time when both feet are touching the ground at the same time, as the gait cycle for each foot overlaps. For antalgic gait, look at the person's feet. During antalgic gait, the stance phase for the affected leg is shortened. This is because the leg is painful and the person avoids bearing weight on it as much as possible. For short leg gait, look at the person's head. The person will seem taller, that is, the head bobs up when in stance phase on the long leg, and the person will seem shorter, that is, the head dips down when in stance phase on the short leg. For Trendelenburg Gait, stand behind the person and look at their shoulders and pelvis. The shoulders should lurch towards the affected side, and the pelvis would drop away from the affected side. This can be explained by looking at the free body diagram on the left, showing the forces around the hip during single stance phase. This is why we all did physics in first and second year and learnt about vectors and center of gravity. You also need some trigonometry to understand this. One reason for a Trendelenburg gait is hip joint pain. On the vector diagram, you can see that the distance labeled A between the center of the hip joint and the abductor attachment on the greater trochanter is much less than the distance labeled B, which is between the center of the hip joint and the center of the body weight. Due to trigonometry, that makes the joint reaction force, which is the resulting vector of forces acting on the actual hip joint, very large, often in the range of about 6 times body weight. By lurching the shoulders towards the affected side, the patient is moving their center of gravity towards the hip joint, thus making the distance B, labeled B, much less, and so decreasing the joint reaction force on the hip. Less force on the hip joint equals less pain. Another reason for a Trendelenburg gait are non-functional hip abductors, such as gluteus medius. This may be due to neuromuscular weakness or due to mechanical disadvantage from abnormal anatomy such as a dysplastic hip. During single leg stance, the body weight, labeled W, pulls down on the side of the leg which is in the air, which in our picture is the right leg. The pelvis tips over, that is, drops down on the side away from the affected leg, because the abductors cannot pull hard enough on the other side to keep it level, like a seesaw where the central fulcrum is the hip joint. The patient also lurches their shoulders towards the affected side to bring the body weight center closer to the hip joint and so decrease the work that the abductors need to do. Thanks for your time. I hope you understand gait a little bit better now. Now go out and analyze the gait of the next person you see walking past.